So at the moment, I'm looking into how babies under 12 months of age develop leukemia. And as you know, there have been great advances in treating childhood leukemias, but there are some rarer subtypes like infant leukemia where the prognosis is really bad. And we know now that all of these infantile leukemias develop before birth in utero. So I'm basically looking to see how this leukemia develops, and by understanding the mechanisms of the development, hopefully we'll understand the pathology better and be able to develop novel and kinder treatments, because the treatment is quite harsh for these little babies and they're most vulnerable around that age. So that's the main project I'm doing at the moment, and it's funded by Bloodwise, a clinician scientist fellowship. Yes, so we've been looking basically how blood cells develop before birth, and we think we have identified a unique fetal progenitor cell, which might be the one that gets transformed to cause the infant leukemia. So that's a new exciting development, and we're really excited to explore the characteristics of this cell better. So we understand the molecular mechanisms that are driving this very aggressive leukemia. Firstly, you don't find this progenitor in other tissue types, so you don't find it after birth. So we've looked in bone marrow from children and adult bone marrow, and this progenitor population is not there. So it seems to be specifically expanded in fetal life. And because we know infant leukemia originates in fetal life and basically needs just maybe one genetic hit for it to develop, which is usually a MLL gene rearrangement. So this progenitor cell, we think, is the target population, which provides a right kind of landscape for the MLL hit to occur. And then you don't need much more for it to transform into leukemia. I mean, there are already some molecular therapies that are being tried for infant leukemia, like DOT1L inhibitors. But what we are hoping is we want to kind of transform this fetal progenitor with an MLL oncogene, and then see downstream what pathways kick in. And once we've identified those, only then we can target those specific pathways. So we are at the moment working on the xenograft model. So the plan is to lentivirally transduce the fetal progenitors with an MLL rearranged oncogene, and then do xenograft models and other downstream analysis.